Now, as we continue to celebrate Pride Month all month, we are highlighting the importance of mental health support for the LGBTQ plus community. And for that conversation, we have Dr. Tyler Traister, Assistant Professor of Nursing at the Quinnipiac University School of Nursing. Good morning.
Good morning. How are you?
Doing well. So nice to have you on the show this morning.
Yeah. Thank you so much for having me.
All right. Now, first up, as we address, health, why do you feel it's specifically important that there's a focus on the health of the LGBTQ plus community?
Yeah. So, mental health is very important for our overall well-being. It contributes to how we think, feel, and act. It helps us handle stress, helps us be productive in the communities that we live. And within the LGBTQ plus community, it's crucial to address this mental health just because of the prevalence of mental health issues that we can see within this community, such as depression, anxiety. We see higher rates of suicide ideation with this community compared to the general population. And we see, our youth being 4 times more likely to attempt suicide when compared to their other peers who are non-LGBTQ plus. So I think it's really important for us to highlight the importance of mental health and the resources that we can use to help support these individuals.
Absolutely, definitely a very serious issue. What are some of the factors that lead to those higher rates of depression and suicide?
Yeah, so there's many factors that can impact that, such as this discrimination stigma that we see throughout the country and world that can impact that. So that societal discrimination and that rejection can contribute to that mental health, especially maybe for a youth who perhaps came out at a young age and their family maybe wasn't accepting our friends and then having to cope with that. And then what we also see from that could stem there is that internalized homophobia or transphobia, where we have those internalized negative beliefs that these people can then internalize on themselves. And that's going to impact our overall mental health and self-esteem. That can then lower us into that anxiety and depression states that happen there. And that family rejection, again, that holds a huge impact on homelessness amongst our youth, with then couples even more factors related to their mental health that we can see there. And then there's also an increased risk of physical and verbal abuse faced by LGBTQ plus individuals. So that can place an impact on our mental health. If you're someone who maybe was attacked or verbally abused, where do you turn for help? Who can you then trust? Will those other folks then help you? So it really, but all these factors, whether individually or combined, can really set up a negative playing field for LGBTQ plus individuals.
Right. Now, you touched on people coming out. Sometimes people have great experiences with that, where they just feel welcomed and they realize they didn't really have anything to worry about as far as their friends and family. But on the other hand, that's not always the outcome for some people. Can you just talk about, why that is so stressful and how friends, family, and the community can support the LGBTQ plus community?
Yeah, sure. So the coming out experience is so unique because for LGBTQ plus people, you just don't come out once in your life. Every day throughout your life, you're coming out, whether that's at work, with friends, with families. And when you don't know the people that you may be around, whether that's new coworkers, it's new friends, you may not know how willing they may be to accept that identity. And that could be based off of your previous experiences. Again, that psychological stress of that unknown. What will happen when this happens here? And like you said, there are stories and there are people where you come out and it's this huge relief and this burden that's taken off of your shoulders, and you can start to feel your true identity that's coming out there, and you have that. But it's just that risk of every time, am I going to be rejected, or am I going to face some type of negative backlash or some type of comment that could then cause that internalization and internalized homophobia or transphobia that could develop there. And it's just that constant interactions that we have with those individuals throughout that every day that can make that coming out process for some people very stressful, that can negatively impact their health.
Yeah. So it's definitely important to find a good support group and people who love you, who will accept you as you are.
Absolutely. Yeah.
All right. Thank you so much for joining us this morning, Dr. Traister.
Yeah. Thank you so much. I really appreciate the time to talk about this important topic.